Folks, welcome back to another episode of the I Am GPH podcast. And today we have an awesome guest with us. We have Kate Porterfield with us. Kate was a double graduate at NYU, doing a BA in Global Liberal Studies and a Master's of Public Health in Environmental Public Health Sciences. Now, this intro is going to be long because Kate has worn so many hats. Kate actually started as a fifth grade teacher here in New York City. And then before moving to the global stage, Kate also co-authored studies on lead exposure and managed research projects in countries like India, Bangladesh, South Africa, and also conducted a community-based research in countries like Ghana, which I can't wait to hear about. Now, Kate is pursuing a Master's of Social Work at Hunter College, focusing on clinical practice with individuals and families. Alongside her studies, she works as a mental health program manager at KIP Forward, which we'll call KIP, and she provides counseling and case management for young people navigating everything from mental health to housing and even immigration. I can't wait to hear about all these stories and the things that Kate has to share, and I'm sure all of you can't wait as well. Kate, welcome to the IMGPH podcast.
Hello. Thank you for having me.
There's so much on this list that I mentioned of the things you have done. When people ask, what do you even do? How do you answer that question?
What I do now or how I got here?
Both.
Okay.
Yeah, how did you get here? Let's find out about your public health journey.
We're going to have to take it all the way back to high school, which feels like forever ago now that I'm talking to you. I grew up in Atlanta, Georgia, and I went to a high school that was very STEM oriented. On that path, I thought I was going to be going to med school. I quickly learned that I am horrible at chemistry, but I am super interested in global studies. So when I actually was at a doctor's appointment going into my senior year of high school, I mentioned this to my then pediatrician, and she was like, "Oh my gosh, that's crazy. Like, yeah, med school might not be for you, but have you thought about public health?" And it's a pathway that had always kind of just been in orbit. I had family members that had studied public health back in the day. Something that I was like, okay, this could be cool. Thought about minoring in it when I got to NYU. And then pretty early on in GLS, or Global Liberal Studies, my then advisor recognized that my interest in public health was substantial enough to make a career out of it. And she said, hey, we actually have this new pilot program coming up. It's a 4+1 between GLS and GPH. Would you be interested in being the first student to try it out? And I was like, yeah, sign me up. So I think that my interest in public health was very much driven by a overarching passion for health and community, but was definitely driven by understanding people and why we do the things that we do, and then tying that together, how can we help each other in bettering the communities that we're in now? So I did the 4+1 program as part of GLS. I did a senior thesis. It focused on the bioethics of triage in the climate crisis. So I'm really interested in health ethics. I definitely am interested in climate change, climate crisis. That is partially what drew me to environmental health when I got to GPH as a concentration. And when I graduated NYU, it was 2021, so hell of a time to be doing public health in the middle of the pandemic. And I had an additional year left in the program, so knew I'd be taking GPH classes at night and was looking for a full-time job during the day. And in tandem, while doing this public health work, I had had a lot of overlapping experiences with educational outlets. So I did literacy programs at New York City high schools. I had done some classroom teaching during the middle pandemic. So 2020 to 21, I actually was working as a mental health program. I guess it still would be developer, but it was for a pod learning group back in pod learning. Sorry, I'm saying a phrase that I realize I haven't heard since 2020. If you remember when the pandemic hit and parents were trying to figure out how to normalize school for their kids again while doing Zoom, some people decided to create these pod learning groups where parents would bring students together in their little safety bubbles, and kids would do remote classes all at the same time from, say, someone's home, could be from. We did it in what was essentially a WeWork, which was really funny. So I worked with this organization called Togetherhood and was supporting students both with their classroom learning, but also thinking, how is the pandemic impacting them mentally? This was a group of 5 and 6-year-olds. So thinking, how can we address resilience in this age demographic? How can we make life more normal for them now? And so coming out of this experience, going back into my 5th year for GPH, I had a connection who worked at the Dwight School on the Upper West Side. It's an IB learning school, does K through 12, or actually it's pre-K through 12. And she said, hey, I think you actually would be a really good fit as a classroom teacher. Have you ever thought about doing this? I had never thought about it as a potential career, but I was like, I would definitely be interested. I interviewed. We ended up being a really good fit. And so I had the pleasure of being a fifth grade teacher for 2 years at the Dwight School. I had a co-teacher, so I had a mentor as a result of it. And I realized it's a very winding path, so bear with me. So we finished the first year of teaching. I graduate from GPH. Then faculty member Jack Caravanos, who was my mentor during this program, knew that I had this very established interest in environmental health. And he said, have you ever heard of Pure Earth, this organization that had been highlighted in class? And I was like, oh, I know about Pure Earth. And he said, I want to connect you with the then president, Rich Fuller. I think you would be a really good fit for a research project he's working on. So this was in tandem with fifth grade teaching for my second year. Rich took me on board to be working on some early on lead research. It was specifically trying to establish what is the base level of lead exposure in 4 U.S. jurisdictions. So we did a cross-population study. It was between New York, Washington, California, and Oregon. I was teaching during the day. I'd go home at night and I'd write this research paper. And then at the end of that year, Rich offered me a full-time position to help out, pretty much like revamp some of the research projects that had been ongoing in the background at Pure Earth. So I came on as the research program manager. Should I pause there?
No, please.
Keep going?
Please,
okay. Yeah. I was at Pure Earth for a total of 2.5 years, and then I made the pivot into social work back in January of 2025. It was no lack of love to environmental health and everything I was doing at Pure Earth. I absolutely loved my experience there. I just realized that I've been doing a lot of experiences that required sitting behind a computer and at a desk and doing data review and writing and all of this primary research work. And I just realized that so much of my career had been driven by human connection and working with people face to face, whether it be with teaching, whether it be doing the mental health development, even doing the research with Pure Earth. The ones that I was just most energized by were all of the community health-based research programs. So I realized that I love public health. I was just approaching it from the wrong angle. And that's what got me to social work. So I decided in late 2024, early 25 to make the pivot to social work. And through this path, it allows me to not only approach public health from these broader public health systems, but also to better connect with the communities day to day that we're working with for so much of this research and intervention.
I keep hearing from all the guests we have spoken to is that public health is everything, public health is everywhere. And you're a great example of that right now, where it started here, but it went there, but it went there, but it's all it's really interconnected. I almost wanted to ask you, like, oh, how did NYU help you to get to your public health journey? It seems like NYU just opened portals and you walked into those portals every time.
NYU opened so many doors for me, and that was through both GPH as well as GLS. So yeah. I have a lot to thank for both of those schools.
Which is for you, I think it almost feels like every single one was a pivotal moment, but which one are you the most thankful for, if anything comes up like, wow, this was the one that opened the biggest portal for me?
Having taken environmental health with Jack Caravanos at NYU really solidified not just like a passion for environmental health, but he helps me realize that there are just so many avenues to be a public health professional. It didn't have to fit one mold. And Jack was actually one of the first people while I was at Pure Earth to ask me, so where are you going to go after this? And just kind of reminding me that I didn't have to stay in this position if it wasn't a best fit. And I don't think that was at all him trying to push me one way or the other, but more just reminding me that you can wear all these different hats, and doesn't mean that you're changing your mind or constantly switching from one thing to another because you can't commit. It's more that you have such a wide breadth of skills and experiences. And I know for myself, my end goal is to be able to synthesize these together or coalesce these together and make that just the most fruitful career that I can.
Yeah, we interviewed him on the podcast as well recently, and it was mind expanding for me as well, the amount of knowledge he has. And it seems like a lot of the students we have also spoken to find a great deal of mentorship in him. He makes people think of things that are usually we don't think of as students in this phase. Tell me about Pure Earth. What was that like going there, starting that experience? It opened up a new portal for you, interest in environment. It just gave you all the path to where you're going right now. So what was it like working there?
For those who don't know, Pure Earth is a nonprofit based in New York City, but they operate across 9-10 different countries and other regional sites. The main mission of the organization is to remediate heavy metal pollution, specifically lead poisoning and mercury poisoning. So when I came on board, both with those early research projects and then as the research program manager, I worked primarily in the lead space. The day-to-day was so cool because we had so many different factions of the organization operating side by side. So I had the pleasure of working with then President Rich, who was overseeing all of the new research that was going to be coming out of Pure Earth. This was everything from testing cosmetics sold on Etsy for lead to figuring out how can we make lead ceramics in Mexico made lead-free? How can we create safer items in all these different communities? I also had the pleasure of working remotely with so many of our different country directors. So I worked with teams based out of Ghana, Bangladesh, India, the Philippines. And you hear it a lot when you're in GPH about how public health is global. There's a reason that's the school name. But I didn't have a week that went by where I wasn't speaking with someone from 1, 2, 3 different countries.
This is at Pure Earth.
This is all at Pure Earth. And it definitely hit me a month or two into the job where I think I was coming out of a Zoom call and it was like guys from Tanzania, and then I was speaking with a woman from Indonesia, and then I was pivoting and talking to the New York public health team based out of NYC Department of Health. And I just thought, I have never felt like I was in the United Nations before working in this job. And that definitely brought it to life for me. So yeah, day to day, it was really cool. We had a combination of doing research, we had advocacy, teams were doing community-based interventions. I was more on the research side, but I had the pleasure of supporting some of these interventions, specifically when we were in Ghana for a joint trip with NYU. So it was just like a very unique role where you could really decide based on research where you wanted to go in the world metaphorically and literally.
First off, can you explain what community-based intervention is? And then I'd love to hear about the Ghana project that you just brought up.
Community-based interventions or community-based research is, in simplest terms, the idea that when people are doing research, rather than designing a study and going into a community and saying, this is what we're looking for, this is what the intervention is ideally going to do, and here are the solutions, you design and execute everything in collaboration with that community. So you should be going in and surveying a community and saying, what do you need? What are problems that you think are most important? And when we think of solutions, what are solutions that are actually feasible for your lifestyle, whether that be your culture, your economy, religion? And community-based research is something I don't think unique to public health, but it certainly is one of the bedrocks of public health and what makes good public health happen. So for Pure Earth, back in March of 2024, we had a partnership research trip with NYU led by Jack Caravanos and another NYU student who the mission of the trip was kind of twofold. The first was, from Jack's perspective, he wanted to be able to create a series of educational videos that were going to be used through a VR platform for online learning, where we would go to different toxic health sites across Ghana, everything from gold mining to places where they were making artisanal pots and pans in local smelting shops, and filming interviews both with the locals and talking about these different processes, doing just like surveillance videos so people could get a sense of what it's like on the ground. And we traversed, I think, truly like a third of the country in a week to be able to make that happen. Yeah, no, it was go, go, go. And then from Pure Earth side, I had been working on a pretty lengthy research project with our research team that was all about the risk of lead poisoning in artisanal pots in Ghana. To give some background on this, not unique to Ghana, but we were just looking at this for our study since we had connections through our Ghana office and previous research. There is a system in smaller Ghanaian communities where local pot makers will take scrap metal, that whether it be broken fans, car parts, old like pots and pans that you're getting from people's kitchens. But then all of those particles, which includes lead as well as other heavy metals, gets released into the air. So people who are making these pots are inhaling these fumes during the production process. But then afterwards, when they cast these pots, so they're pouring this molten metal into a sand pit, shaping it into a pot, and then they sell it in the marketplace that's 20 feet away from where this artisanal shop is. They are incidentally selling pots that are contaminated with lead. And when families bring these pots home and they're heating them up over their stove, this heat allows for the lead in these pots to then release and enter the food. Our goal was to go in and meet these pot makers, better understand their process, understand where they're getting these scraps from, why do they use these sources, what are parts of the production process that we're not thinking about from an outsider's perspective, and then what's it like from them from a lifestyle. How are they making money off of this? Who are they selling to? And trying to keep all of that in mind to then design a study to figure out how we can make this pot making safer.
What is a day in the life of actually discovering this and then navigating it? It feels like a third of the country's covered. Like, what happens? I wake up in the morning, I get a meal, hopefully not cooked in a lead pot, and then taken, like, what is a day in the life in one of these areas?
I can speak to the pots that we saw made in Accra. So we were at an area called Agbogbloshie. It's actually, if you take an environmental health class at NYU, you inevitably learn about it. It's one of the 10 most polluted places in the world. The best way I can describe it is concentric circles. So you enter Agbogbloshie from the outside, and it's like a ring of market stalls. So everything from these pots that I just talked about, people are selling local produce. They might be selling like rugs and T-shirts. You get a lot of resold Western graphic tees, actually, which is kind of funny to see, like outdated cartoon characters for sale there. And you then work your way past this first round of stalls, and this is where you enter more like the living spaces. So you have everything from the higher end of the socioeconomic spectrum for Agbogbloshie. I want to just clarify, it's a very low socioeconomic region. So envision a maybe like cement style shack with like cement block walls, door. You might have like a mom and her children sitting around during the day cooking together while dad is off selling something in the marketplace. They have churches inside this part of Agbogbloshie. So we were sitting with a family at one point who had just attended a service, and then we're just like debriefing with friends after, the way that you would anywhere else after a church service. You have the artisanal pot makers in this area. So you're having these smaller shacks as well where you're producing. I know that we saw people selling the pots, eyeliner that is oftentimes contaminated with lead. We saw sold in this marketplace. You see a lot of children and animals running around, everything from dogs to goats to sheep. And then there's a pretty distinct partition. So at this point, we had to go with someone who had lived in Agbogbloshie during their life. It's a place that a lot of like documentary filmmakers will go to, and very understandably, in speaking with locals, there was some blanking on the right word here, not hostility, but they'd experienced a lot of people coming in and had a lot of experiences of like Western documentary film crews coming in, and found it to be a very voyeuristic experience. So in order for us to go there, not only was it pretty imperative that we work with someone who had been part of this community and knew people, but also we showed that we weren't there to film them and then leave. It was, we're here, we want to learn. We really are here to like speak with you and just be with you and commune, and then hopefully be able to gain some knowledge to better support this community in other ways. So you're in the second row of Agbogbloshie now with all of the higher income homes. So you have families and children and animals and artisans. And then you go into the next layer deeper. And this is where I definitely felt in the moment a very stark contrast in the life that you're experiencing. It was, Agbogbloshie functions as the electronic e-waste dumping ground for all of Western Europe and parts of Asia. So you have, once you hit this next round of the circle, these piles and piles of trash. And I say piles, I really think it should be more compared to like a small mountain. You can see people scaling the sides of these trash piles. There's cows and goats and sheep like roaming all of it. So you've got this combination of the literal garbage, e-waste, people scavenging through these piles of waste. Because again, as we talked about those pot makers, where are they getting the scrap metal from? But these local trash sites. All of this trash is then accumulating on the ground. It's being consumed by the animals, which people are also raising to eat, both for milk and for meat. The trash makes its way onto the ground. It seeps into the soil and it seeps into the water. So you then are surrounded by much more, I would say, destitute shacks at this point. Day in the life, you might have someone that is living in one of these huts, goes and scavenges for trash. They might try to resell these scraps to the people who are living in the next ring at Agbogbloshie. Maybe they're selling it outside of the marketplace. But you get families that are all living in these very, very small quarters with the garbage residue surrounding the ground. And then you go into like the final circle of Agbogbloshie. And this is where I'm blanking on the river name, but the main river that runs through Accra has one of its entry points close to Agbogbloshie. So you have a combination of these humongous trash piles, the actual body of water that's running through this part of the slum, and then it goes into the larger body of water. So this is runoff that's impacting other parts of Accra as well. And in this like really central part, this is where you get most of the e-waste. So you have people that are scavenging the e-waste specifically to resell parts that include copper. This is some work that Pure Earth had done in years past in tandem with other NGOs and the Ghanaian government, where in order to get copper, you have to traditionally burn the material. So you're burning the rubber off of it and then hoping that you'll get the copper wire at the base. In order to do this, you're seeing these just like bonfires of flames coming out on top of the trash piles. So you have constant release of these toxic fumes into the air. This fume, the trash residue, it's all going into this water that's then seeping throughout the community and then back into the bodies of water. You're like walking on trash while you're going through it, and then you like will miss a section of trash and it's just 3 feet of water. So you're kind of like hopping over these little river streams. And I have a hard time describing it out loud. It's one of those where after I came back from the trip, people wanted to know what it was like. And I was like, I kind of have to show you a video. There's nothing else I could use to describe it quite as well. But in addition to these trash piles and the garbage runoff, you also have all the animals. So you have just like constant mooing and
it's almost like there's all the pollution and all the toxins are connected in the food supply, in the water supply, in the environment around. And it seems like this is such an eye-opening experience. Even the way you're describing it, I felt like I was there right now and seeing everything. And it just shows that, is that the only country you saw something similar in, or were there other countries you went to and had similar experiences?
That was the only one for me where I was in that style of community. The people that I've worked with through Pure Earth and then some other partner NGOs had mentioned this is definitely not unique to Ghana. You see this in a lot of low socioeconomic regions. I know the Philippines, Indonesia, parts of India, there have been similar anecdotes. And the through thread is that a lot of this is because you have displaced garbage or all of the waste from these higher income countries that are then put into low income countries and forcing locals to deal with it. So you can definitely just feel the impact of globalization and some of its negative ramifications in that moment. So,
I mean, you were clearly, it's evident that you were invested, you were in the weeds of this whole thing, and you were in the toxins, if I should call that, throughout. And I wonder, was that where the transition from public health to social work was formed for you?
My God, how can you tell? 100%. It was, I had this like one really specific moment that kind of, I think, turned the switch off in my head or on in my head, where we were leaving this like inner section of Agbogbloshie, the most inner. I did describe it as like Dante's Inferno, where you can feel it getting more intense as you're going further and further in. So we're in this like middle section. You've just gone through like the fire burning pit area. You're trying to traverse and being told like, don't touch the water because there's definitely like toxins in there that you don't want to bring home with you. And I turn and there were these guys walking towards us wearing the aforementioned like American t-shirts that are being either like trashed or resold as part of these communities. And one of them is wearing a Alzheimer's 5K for the Cure shirt. And I was looking at it and I just thought, wow, we really think about like health priorities across all of like the global landscape. Why would this person give, I don't want to curse in your podcast, sorry.
No, go ahead.
Okay. Yeah. Why would this person give two shits about Alzheimer's and this impending experience when they're grappling with so many other adversities in their day-to-day life, all of which are equally important? And as an outsider, who are we to say this is the thing that should be most important to you in this moment? And I don't mean that at all in a knock to any NGO that does any kind of public health work or any public health organization. And I say that including Pure Earth, but it just hit me where I was like, we're so focused on lead right now. And we're thinking about how lead is impacting everyone in this community. And that's because that's our expertise. I really was just wondering, what does this guy wearing the 5K Alzheimer's t-shirt care about? What does he want to have changed in his day-to-day? Do I think it's lead? I don't know. We haven't even really had a conversation yet with this person. And to be clear, we then followed this innermost circle with that subsequent conversation with community members. So we were able to say, some of them really care about lead. Other ones really care about food insecurity. Other ones really care about the fact that their children don't have a stable education right now. And that definitely was something that shifted my thinking from the angle of public health that I was working in, which was more this like desk research and doing policy-based interventions, to how can I better understand the communities that we're serving, and how can I be a liaison so that those needs are communicated back out to these much larger systems. So that was definitely that turning
It became
point.
more human than just data.
And every single person, not to sound cliche, everyone matters, and no single person is just the statistic. No one in Ghana is, this is, X percent of this country is lead poisoning. Like, no, this is a guy who is living day to day with his own struggles in the way that the rest of us are. And I just realized that so much of what I care about, and also I think what I'm good at, which is just like really sitting down and listening to people, needed to be better utilized moving forward.
So you identified like a skill and a passion that unlocked, and then where did that take you after this? After what I would call an eye-opening experience.
I was nervous about walking away in that moment, wondering, do I need to give myself more time in this role? Maybe there's a way that I can find a way to utilize these skill sets that I'm looking for in what I'm doing now, and I'm just not thinking creatively enough. And I did some of that soul searching, and I talked to a lot of people in the field, and I realized that what I really did want and need is the clinical social work experience to supplement this. And in talking through this with my support system, I definitely threw out the line at one point, should I give it another year? Like, I have so much going on. In the middle of all of this, like I was getting married, I gone through like some health stuff. Like there was just a lot of other life things happening all at once. And it was my partner that said to me, there's always going to be stuff happening. You can't wait to make this pivot if this is something that you're ultimately going to want to do. Like, why deny yourself this time to feel fulfilled and go for it? So that's what did it.
Where did that take you?
Where did that take me? I knew that I was not leaving New York whatsoever, so I was looking at social work programs in the city. I had applied to a number of them, and then ended up being accepted to and really wanted to go to Hunter Silberman School of Social Work. So I started in January with an accelerated program, meaning I'll be done next summer with the full degree. And so as part of social work programs, you have to do 2 clinical placements or internship placements. And my first one was with Kate Forward, which I served as a clinical intern supporting transition age youth, which means people who are 18 to 24 years old, and loved the role, really hit it off with the team, realized that this was definitely the right choice for me. I love working with people day to day. I love getting to actually like be immersed in their life and their conversations. And I was very fortunate that KIP offered me a part-time job coming out of this while I finished the rest of my degree, which is serving as their mental health program manager.
And then has life changed anyway? Are you certain about this area now? Like where does your public health connection and social work connection come in?
Oh my God, I feel so certain. I feel it every single day, both in class and in the work that I'm doing, that social work and public health are, the Venn diagram overlaps, and that middle portion is like 90% of the Venn diagram. It's all about how do we strengthen our communities and the policies at play to better people's lives. And the work that I was doing before with environmental public health was just very focused on how are environmental toxins or how is climate crises impacting people's day-to-day. And I've just pivoted, and now I'm looking at how is mental health impacting their day-to-day. And mental health is this other incredibly crucial part of the public health ecosystem. I recognize too that you can't have effective policy from the public health side without the ability to implement it and figure out how do we need to meet people where they are for this implementation to be as effective as possible. And I think that's where social work really comes in.
And how does one do that? So say there's someone that's an undergrad right now or just started, or it's their first year at taking an MPH, and they're discovering the social work thing for the first time. And just like you, they ended up in public health, and then it's like, maybe I want this. Like, what is this world of social work like? How would you describe it to people?
I would say different than an MPH, my MSW or Master's in Social Work is so much more oriented on the individual person. So better understanding people from a cultural competency lens, meaning how are we immersing ourselves in the historical and current experiences of different groups, whether that be like racial, sexual, gender, ethnicities. It's also a lot more psychological theory than anything we ever touch in public health, meaning how are we understanding people's thinking? How do people approach change is a huge question that's foundational to anyone who's a therapist, but also who's a behavioral health scientist in public health. So the program, a social work program, I think differs in public health in that it's a little less policy driven. It's a lot more about that day-to-day implementation, which if I was talking to anyone who said, I love public health and I think that this one-to-one level intervention speaks to me, you can still do that with an MPH. I don't think social work is the only path you can go. You can certainly get a dual degree. I think it's awesome. But another way to do this would be community health work in public health, where you need community health facilitators to go in and teach people about how interventions work. We saw that at Pure Earth, where if we had a intervention that required changing someone's cooking habits or switching out a contaminated item in their home, you had community health educators going in, meeting with the family, understanding what their day-to-day life was like, and saying, here's the change that needs to be made. Here's why it's important. What are we missing? What would be good for you to make this as effective as possible? And I think that that utilizes a lot of the same competencies that social work does of listening, being open to the fact that people have ideas and might know things that you don't as the superimposed expert in this moment. And also just keeping an open mind that we don't always have the answer. We don't always have the best answer. And some of the best solutions come from the people that are in the community that you're serving. And I think that is true to both fields.
So I have like three things but I'm going to just pick one.
Okay.
I remember reading this, and this is going to be the last one that I ask you. And I think this is a really good pitch you have, a one-sentence public health pitch, which says, education can be used as a tool for public health. What does this mean? It feels like, yes, education can be, but how would you define that?
For me, I think education manifests in a few ways. I think education for or through public health can be everything from broader community education. We think about public health narratives day to day. Who do we trust as experts? Where are we getting research from? How do we convince people that it's worth caring about these ideas and implementing these changes in their life, or just being okay with the fact that these systems exist? So I think education is a tool for public health in one regard, where we live in an age where we can do mass education campaigns in a way we couldn't before, whether it be through social media, which is such a, I think, underutilized tool in public health right now, whether it be through government programming, whether it be through NGO work, and we see that in both local and statewide communities in the US and certainly abroad. So I think that's one avenue for education as a tool for public health. But the one that speaks to me more as a professional and as an individual is how we can teach the foundational ideas of public health to anyone. They don't need to have an MPH to have that. And for me, it's funny because I think we actually alluded to this before jumping into this conversation. I think empathy is the crux of what we do in this field. And I think empathy is a very hard skill to teach in the abstract, but it's something that we can definitely model for people day to day. And I don't just mean children in a classroom environment. I mean adults and peers that we share our day-to-day experiences with. So when I think of education as a tool for public health, I think part of it is teaching people why it's okay to care about other people and why their lives are worth living in the best way possible, and how you can play a small part in that. And frankly, that it's such an honor to play a small part in that. So I think about education as this simultaneously very utilized tool in our public health toolkit in a traditional format, whether it be classroom teaching, whether it be these national campaigns. But I also think that we can really start to harness education as the tool for behavioral change and becoming kinder and more inclusive, and at that root of it, more empathetic to each other in this day and age and moving forward in public health.
I think it's my first time hearing that on the show as well. And this idea that we all know that empathy is important, but really believing in someone else's world and knowing that that's an honor is such a reframe in our mind. So thank you for sharing all of that. Is there for the people that are in the data situation, maybe on the back end, because you have done the back end stuff, and anyone in public health, what is one thing you'd leave with them about this idea of empathy as someone that's getting into social work?
I think I'd return to that comment I made earlier on in our conversation of these aren't just statistics that we're working with. These are people, and people are so much more complex than I think we would necessarily recognize in ourselves, but certainly recognize in strangers. And for anyone who is sitting behind a computer screen or doing this data work, which is so noble, and I love every single person who does that, I think it's important to remember who you're doing that data work for, that it is your neighbor, it's your friend, it's a stranger on the street. And everyone does matter in the grand scheme of life. Everyone has value, no matter who they are. And I think the data work is really important and so valuable in public health because it is so hard to even attempt to quantify or qualify people and who they are and the metrics that are required in order to have good public health solutions. And I think data scientists and anyone who does this work are doing just that. And it's such an incredible feat. And it's something that I really appreciate and wish that we saw more of in other social sciences like social work. So I feel really appreciative that public health puts such a premium on data.
Thank you for sharing your insights, and mainly thank you for humanizing this even more than it already was, and showing us that side exists no matter if you're working in person with numbers and whichever environment it is, because public health is everywhere and humanity is also at the crux of it when we bring it to there. Thanks for being on the show, Kate.
Thanks for having me.
Folks, that's Kate Porterfield. We'll see you in the next episode. Thank you so much for tuning in. And let us know in the comments down below what was your biggest takeaway from this episode. See you in the next one.